The second lecture that I'd like to talk about was Dr. Monica Boen, Boen, and she's a cosmetic dermatologist in San Diego. And I loved it. There was sort of this, excuse me, this new youth movement down at the California Academy of Cosmetic Surgery. I used to be the young one and looking at these old guys go, well, those guys are old. I think I'm the old guy up on the stage now. And in fact, sometimes, we call each other by first name, but if they call me Dr. Tom, I'm knowing, okay, they're a lot younger. They're trying to show me that age respect. And a few of them I think are even my kids' age, which really blows me away, but that's wonderful. They're intelligent, they're highly talented. And what I love about this youth movement is that they're bringing new ideas, new energy to the California Academy of Cosmetic Surgery meeting, but they're also bringing new ideas, okay? And it's wonderful that they are. So Dr. Monica Boen, who is a cosmetic dermatologist in San Diego, gave a lecture on using Botox, or what we call neuromodulators, but using Botox or Dysport, the other Botox that we use quite a bit in our office as well, and using it on the lower face. So what I'm going to do here now is back up a little bit and talk about Botox itself. So Botox, we know, is an injectable. It's a liquid. It's made in a lab, it's very safe, and it relaxes muscle movement. So we tend to inject it in areas where we get what we call dynamic wrinkles. So if we look at the frown, which is between our eyes, and the kids call it the 11s, and when we frown, we do this. When we inject Botox or Dysport in that area, it helps to soften that area. And so you don't have that look of being angry or maybe the world is so heavy on you. And also we know we get a little bit of an eyebrow lift when we do this. So it's, the number one spot, popular area to have Botox injected. That's on the upper face. And a lot of times we also inject in the crow's feet area. And for those who are bothered by their horizontal lines on their forehead, that's another popular area. But then as we, as a specialty cosmetic injectors, as a specialty began to fine tune our techniques and looking for other areas where we can find benefit by relaxing muscles, we started to look at the lower third of the face and the neck area. And that's what Dr. Boen had actually discussed. So I'm going to talk about probably the most common area to inject Botox in the lower third of the face, and that's very effective. So why would you want to inject Botox in the lower part of the face? Well, usually what we're trying to do is soften some type of expression that's relaying maybe an emotion that we don't want. So we talk about the frown. I know that me being a patient, just like everybody else, I thought for a while there, this was some 15 years ago, I thought, I'm not sure I need Botox anymore for my frown. And so I decided not to do it anymore, thinking I'm a guy, I can have a little frown, I can show a little bit more emotion, so forth. And I went home and I remember my wife asking me what was wrong, and I was perfectly happy. And then my daughter, who was back from graduate school, said, "No, Dad, really, is something bothering you?" And I thought to myself, I stopped using Botox and Dysport in my frown area, and I once again regained what I was doing chronically without knowing it, of frowning. And that gave me a look of not being happy, which was totally not who I was. So what did I do? The next day I went back to the office and I asked Mary, our lead nurse, I said, "Mary, I need my Botox, okay?" And so I've just been doing it ever since then. And what it does is it helps with the mirror phenomena. In other words, if you're looking at someone and you have a happy face, what do they usually do? Jeff, what do they do usually, right?
They smile back.
They smile back. So yeah. I walked into the radio station today, and I see, cool Jeff, young guy with his baseball hats on backwards, and it gives me a big smile. And so what do? I smile right back at him. So that's the mirror phenomena, and that's what we try to use Botox for. So let's get down to that lower third of the face. So one of the things that can happen is if you touch your chin, and then and with two fingers, and then slide your two fingers away, so you're going to where on your jawline, where the side of your mouth, and then go up a little bit and pull down so that the sides of your mouth on the outside are being pulled down. So it looks like a frown, okay? Those muscles there are called the DAO, which stands for depressor, meaning pulling down, angularis, meaning they're at an angle, oris, which is the mouth opening, O-R-I-S, the DAOs. So you can sound real fancy and technical. Say, hey, I'd like you to inject my DAOs, or the depressor angularis oris. And when these muscles are chronically pulling down, what they can do is give you that look of being unhappy or angry or not being very nice. And in fact, a lot of the young kids will call it the RBF, and you've heard of that, huh, Jeff?
The resting censored face.
Yes, exactly. The resting B face, okay? And it's a real entity where, and unfortunately, and unfortunately, not trying to be misogynist, but it's even more significant in women. It seems to be more of something that's maybe because of men's facial hair, you might not see it as much, but definitely I have more women coming to me who say, I have the RBF and I need to get rid of it. So what do? We usually put a little bit of Botox right in the depressor angularis oris, the DAOs, and that helps to bring your frown. It's actually, I know it's the old saying, let's turn that frown upside down. And it brings the side of the mouth up. And it can be, in the appropriate patient, a dramatic improvement and help these patients in terms of how the world reacts to them. How do they mirror to them their emotions? So that's an injection, a most popular area of the lower third of the face, of injecting the DAOs, or depressor angularis oris, to, again, get rid of that RBF, or that resting B face. So that's the most popular area. Another area that's popular, and this is going to be more aesthetic, not so much emotion, but more just sort of the visual of looking, is where right on the chin, we have a muscle right there. If you grab your chin, you got that muscle right in your fingertips, right? And that muscle can contract. And when it contracts, that muscle kind of pushes upwards. If you now just put your finger on your chin and push it upwards towards your mouth, it kind of does this, and it can become wrinkled, and it can look like a Shar-Pei. And in fact, that's usually the comment that I will get from a patient. She may say, my chin looks like a Shar-Pei, or looks really wrinkled or pebbly. What can you do for that? Well, injecting Botox or Dysport in that area helps to soften that contraction of the mentalis muscle. It's called the mentalis muscle. The way I remember is that we're all mental, okay? So it's the mental, it's that muscle right there on your chin, and it helps to relax it, and it helps to get rid of that pebbleness or that Shar-Pei look of the chin, which is an aesthetic concern. Also, from an aesthetic concern, if you just turn your head a little bit, if you're looking in the mirror and you look at your chin, if that muscle is pushing up, it shortens our jawline. So as we get older, we tend to get concerned about losing our jawline, that definition, which is more youthful, or more shows a more stronger personality, if you will, visually. And if we can relax that chin muscle and let it come down, it extends our jawline and gives us a more contoured jaw. So injecting the mentalis muscle, or the chin muscle, is also useful for that aesthetic benefit. Then there's also called the Nefertiti lift. Do you know who Nefertiti is?
Queen Nefertiti, right?
You got it. This guy is so smart. I mean, I think he's 19 years old. How old are you?
31.
Oh, okay. There you go. He's 31 years old. How do you know about her?
Just from education.
From
I was
education.
big into mythology back in the day.
I love it.
Yeah.
So you're a perpetual student.
Yes.
I love
Always
that.
learning.
Okay, so when you become an injector, I'm coming to you because you're passionate. I love that about education. So Queen Nefertiti, if you look at that, she had a long neck, this beautiful long Egyptian neck, and that's why they call it the Nefertiti lift. And so the muscles on the side of her neck are called the platysmal muscle, and they tend to pull down, and so they can affect the jawline in its definition. So what we can do is inject Botox or Dysport just underneath your jawline, if you just run your finger underneath your jawline from the back of your jaw towards your chin, and injecting that area with small amounts of Botox or Dysport, it relaxes that chronic contraction there, and you can get a little bit of a lift along your jawline. Now, when we talk about that neck lift and so forth, I always want to make sure we're clear. We're not talking about a surgical neck lift. We're not talking about a surgical lower facelift, okay? But for those who are beginning to see those changes, just that little bit of Botox in that area may be a benefit for you. The other area that we're looking at is what we call the platysma bands. And so the muscle of the neck is called the platysma, and that's where we inject it for the Nefertiti lift along the jawline. But sometimes if we give a grimace, we see these lines that run down from our neck down to our collarbone. And it looks like a band, almost like a banjo string. And so what you can do is if you inject this with just a little bit of Botox or Dysport, that will soften it and will actually give you more definition of the neck area. So those are the great areas of treating with Botox or Dysport. And it's kind of funny. I'll tell you a little funny story. So, I'm not crazy. I don't tell my wife to do anything, right? Okay. But, she was asking me, well, what do you think I should do? And I said, well, you could do, and this was many, many years ago as I was getting into the field, and saying, well, you could do Botox or Dysport here and here. And also, you could get your neck treated right here. And she said, oh, I'm not interested in that. That doesn't bother me. So I said, all right, that's fine. And then she was kind enough to be a guinea bunny for one of our training sessions with our new nurses. And we had a nurse that came down from Washington, state of Washington. And I remember her talking, and then she pointed to my wife's neck and said, those are platysma bands. You can treat them. And of course, she said immediately, oh, yeah, sure, that'd be great. So you can see you're never the Messiah in your own land, right? And so it always makes me laugh. When someone else tells her to do it, she thinks it's a great idea. Alrighty. So,